So, of lately, I came across a very interesting case of low back pain in a young female tennis player. Let's go through this case study. Before starting on this case study, I believe that in this particular case, early diagnosis was the key for her return to play. By identifying her injuries early, we could start the right rehabilitation program. This allowed her to safely return to the sport she loves, and it not only just preserved her athletic career but also ensured a healthier future on and off the field. So, this is the case of Rasha, a 14-year-old right handed tennis player. She's been training since she was 8 and currently practices 4 to 5 days a week. Despite her dedication towards sports, she does very little strength and conditioning beyond her usual tennis routine. She also loves playing other sports like soccer and hockey, which highlights her passion for staying active. So, we digged more into the past medical history. So, she said that, last year also she had a similar pain in her lower back after the play, but that was on the left side. She rested for a good 2 weeks and then she returned back to her sport. This pain, since then, keeps on recurring after high velocity of activity and always get better with rest. But of lately, the intensity and the frequency of the pain is increasing, and she thinks that even the slightest of exertion in terms of hyperextending her back or rotating her back causes frequent pains on the left side. Important is to think that why it occurred. According to me, when we push our bodies beyond the limits, injuries can happen. Now, it could be because of the stress, it could be because of the poor nutrition, it could be because of the incorrect posture or exercise technique, or a sudden spike in the activity or natural growth spurts. Identifying these factors early help us create a targeted plan for a safe and successful return to sports. Apart from all those factors, some other important aspects which we must consider is that, what was the playing technique? How long did the patient play it? Was it different from the usual technique or the usual plays or games? When was the training sessions scheduled before that? Any other activity associated with the match which can increase the pain? And how many plays or the games did she play? Digging deeper to all those details, let's know more about Rasha, because if we don't know this, we can't prevent the recurrence. So in tennis, we got to know that she usually used kick serve technique and she do two-handed backhand hitting. Her mother told that she is a fussy eater and have poor sleep quality, which tells me that she have some nutritional deficiencies definitely, because she's in a growing age, and because of the poor sleep quality she's spending more time on the phone or the social media, which is not allowing her to rest her body properly, and she's tired most of the times. Her mother also said that she has anxiety before the play and the feeling of funny stomach, because of which she skips meals a night before the play, and she has got a lot of anxiety because of which she feels tired. Another aspect was that she is very passionate about tennis and wants to play at a regional level. So she always try and give more than 200% in her game, which is much beyond her body's capacity. As by the history, I came to know that she's not doing any strength and conditioning in particular. Then we had more conversation regarding her condition, and she told me that all the activities that required extension or the movement of the back resulted in pain. Also, when she serves with backhand hitting technique and her back is fully rotated, it's painful. Any sport in which she's jumping, hopping, kicking, and serving, it results in pain. Of lately, the pain was more on turning in the bed and in prolonged sitting positions, which never happened before. So, this tells me that the intensity and the frequency of the pain is increasing, and also the disability in terms of her daily activities. Like earlier, the pain was just coming while she was playing sports, and now it is more also when she is on her bed turning or sitting for prolonged period of time. After a little more discussion, I came to know that 10 days back she played the tennis tournament, but 2 days after that she was fine and suddenly the pain appeared. She won the tournament and there were several rounds. She gave more than 200% to win the game, and she was unable to sleep a day before that and did not take proper diet because of anxiety and funny stomach, which she usually does all the time. So this tells me that she's a strong player and she's very passionate about sports. So because she wanted to win the tournament, she played more than what she plays on usual days or usual games, which could have exaggerated her back pain. We started with checking her symptoms. So I found that there was bilateral tenderness on the back at the level of L5. She had this lot of paravertebral muscular spasm with lumbar lordosis. Even her quadratus lumborum was tender and in spasm. I found that her right side has more muscular hypertrophy as compared to the left side. It could be because she was the right-handed player and was playing since the age of 8 years, so it could result in muscular hypertrophy on the right side. We tested the SLR and it came positive at 70 degrees. There was pain in her back. When we did certain movements like active lumbar extension or rotation or right side flexion, everything was painful. So it gave me the idea that whenever we are compressing the posterior segments, the pain is eliciting. Lumbar range of movement was restricted because of the pain. The slump test was positive, but she also complained of her hamstring pull and tightness in the hamstring. So we checked for that with lumbar dissociation test. In the lumbar dissociation test, she was unable to maintain the active knee extension and there was a lag of around 40 to 45 degrees. She really found it very hard to maintain that pelvic in anterior tilt position and lumbar lordosis, which is ideal for a sitting position. We also found that the single leg glute bridge was very painful. Whenever she was performing that, she was unable to hold that position and it resulted in a lot of pain on that area around L5 because of the extension and the rotational component involved, which she needs to balance in a single leg glute bridge. I also observed that she's a mouth breather, and when you breathe through your mouth, if you take a deep breath through your mouth, you will feel that your lumbar spine is going into a lot of extension and your oblique muscles and your diaphragm is not working efficiently, which causes more stress on your low back. So this was an important finding during my physical examination. Compiling all this together, the first and foremost thing which came to my mind is definitely tennis causes stress on your back. Now, because she was a fussy eater, obviously there was lack of nutrition, and it was not enough to fulfill her body demands because of the growing age. She also had a history of previous injury a year back on her left side, and rest always relieved the pain. So this takes my attention towards a certain bone injury or bone bruise or a bone stress which can happen. High impact activities like hyperextension and rotation were painful. Kick serve technique was painful. Two-handed back hitting, which requires rotation component, was painful. And otherwise, she was fine. So, any activity which puts strain on your back structures was painful. Again, it diverts my attention towards any type of bone bruise or bone stress injury, which must be happening. The pain intensity and the frequency is increasing since a year, and she has got a lot of paravertebral muscular spasm and Heim's tightness. The paravertebral muscular spasm is not so common in young athletes, and if it is there, it could be because of any underlying pathology which might be happening. So, what can be the diagnosis? According to all the history I collected, it looks to me like a classic case of lumbar spondylosis, which is a stress fracture. It occurs as a bruise in the bone due to prolonged wear and tear and less strength, which is very common in young athletes. So we straight away went for an MRI, as she also had a previous history of low backache a year back, and the frequency and intensity of it is increasing. So the MRI reports confirmed she had chronic grade 4 left pars of L5 affected, and acute injury, acute stress of grade 2 at right L5 pars. And there was edema which had intermedullary extension to facets as well. That's why the area was very tender, and she has got a pain on the right side as of now, and the pain on the left side also keeps on coming back whenever she strains her back. That on the left side she has the terminal bone stress injury, and on the right side she has started developing progressive bone stress injury. To confirm our diagnosis as spondylosis, it's very important to devise a treatment protocol accordingly. So if there is no red flags, we have to straight away start with 2 weeks of rest. The pain should get better with 2 weeks of rest. And if it is not getting better and the ADLs are still painful, then we have to go for an MRI to confirm the grade. If we become pain-free at about 2 weeks of rest, we have to begin the symptom-led rehab protocol and strengthening and conditioning so that the return to play can be done as soon as possible. Now, if your MRI confirms grade 1 to 3 bone stress injury, we have to begin with at least 3 to 6 months of rehab protocol for these young athletes so that they can return back to their sports. And in case if MRI confirms grade 3 bone stress injury, we have to keep on managing pain, and we have to do functional rehabilitation of such athletes. Treatment strategy is based on 5 principles. First says protect the spine. Second is let it repair. Third is we have to start to move and start training the muscles. Fourth is we have to start to train to return to sports. And the last one is return to play. My expert advice will be that early stage or progressive lesions of pars till grade 3 can be treated with the rest of 8 to 12 weeks. Objective is to achieve the bony union because of good potential of healing in the growing years. And the chronic lesions of pars interarticularis, in this we have to do rest for 4 to 8 weeks. Objective is to aim to relieve the low back pain because of very small chance of achieving bony union, and we have to do more training and strength and conditioning of the muscles so that the load is distributed equally and can be prepared for returning to sports. Takeaways from this study is that proper strength and conditioning is very crucial for injury prevention. So all the young athletes who are into sports have to pay proper attention to the form of the play, to the strength of the muscles. It's very important. Recovery matters. You have to rest your body. You have to rest in terms of sleep. You have to take good nutrition. You have to do stress management because all of them impact your performance. Third is that you have to gradually return to sports, which ensures your long term success. And last is regular expert checkups can prevent recurrent injuries. So, if you have a pain, it is for a reason. It is advisable that you go see an expert because, as we come to know here, that early prevention is the key. The early initial bruises, stresses can heal faster as compared to the chronic lesions.